This is some kind of practical joke. It's not funny. And I know funny. I'm a clownfish.
No, it's not. I know it's not. I'm so sorry. See, I suffer from short-term memory loss.
Short-term memory loss.
Short-term memory loss? Wait a minute, Dory. Don't you mean anterograde amnesia?
Anterograde amnesia is a loss of the ability to create new memories after the event that caused the amnesia, leading to a partial or complete inability to recall the recent past, while long-term memories from before the event remain intact. Imagine life only living in the present. You are unable to recall recent events. You are unable to stay on track. You are alienated from ongoing events. Time, essentially, has stopped for you. Anterograde amnesia can be caused in a variety of ways, including brain injury, especially to the hippocampus and surrounding cortical regions, misuse of benzodiazepine drugs, and chronic alcoholism. A recent study examines the potential benefits of smartphone technology in helping anterograde amnesia sufferers cope with the day-to-day memory demands and future planning.
Compensating for anterograde amnesia, a new training method that capitalizes on emerging smartphone technologies. Meet RR, a 55-year-old woman who suffers from moderate to severe memory impairment in the form of anterograde amnesia. After RR began experiencing memory issues, including general forgetfulness and getting lost, she was diagnosed with a colloid cyst. Complications which arose after surgery required RR to undergo prolonged inpatient, then outpatient supervision. Upon discharge home, she required 24-hour supervision due to severe memory impairment. RR reported having ongoing problems with retaining new information and experienced topographical disorientation. Memory strategies such as setting alarms, making lists, and mental elaboration had proven to have only limited benefit. RR used notebooks as a form of external memory in which she recorded information, but this became impractical as the number of books increased.
The researchers, Svoboda and Richards, created a two-stage training program to teach RR to use a smartphone to independently support her memory.
In the first phase, RR was taught basic skill acquisition couched in the principles of errorless learning and vanishing cues. Software applications were introduced individually and then mastered before moving to the next. Tasks were designed to be simple present-day entries. Phase 2 targeted generalized use of the smartphone and added more complex tasks, which introduced future planning and future events. More nuanced examples of day-to-day functioning was introduced via role play. The intervention training took 8 weeks to complete.
Svoboda and Richards designed a within-subject A1-B1, A2-B2 single-case experiment to evaluate the impact of smartphone use on day-to-day prospective remembering. The experiment required RR to keep a schedule of phone calls to be completed at various times over the 2 weeks.
Following the A1-B1, A2-B2 paradigm, prospective memory was measured at baseline in the 2 weeks prior to the training program. Following the smartphone training, using the smartphone, and then without the use of the smartphone, and finally with the use of the smartphone during a 4-month post-intervention follow-up. After memory intervention, RR's rate of phone call completion rose from 40% to 90%. This improvement was maintained 4 months post-intervention. Additionally, RR used the smartphone extensively in other untrained ways to support her individual memory needs.
Finding Nemo is a film that takes you on an underwater journey in search of an overprotective clownfish's abducted son with the help of a blue tangfish who has amnesia. Throughout the film, Dory is able to recall some semantic memories such as facts, the ability to read, and the ability to speak another language. However, she is unable to obtain episodic memories, which are emotional memories drawn from experiences.
Dory uses repetition as a strategy for her to be able to remember the address of where Nemo could be found. The priming effect is also used in the film as there are a couple of occurrences where Dory gets a gut feeling that they should do certain things but does not remember that she was warned earlier in the movie.
That's where I'm going, is P. Sherman 42 Wallaby Way, Sydney. Where? I'm sorry, I didn't hear you. P. Sherman 42 Wallaby.
Finding Nemo does not avoid Hollywood cliches when it comes to memory loss. The most notable of these cliches being the moment when Dory's memories of everything that occurred during her adventure with Marlin all came rushing back when she hears a word trigger. This is the most significant inaccuracy in the movie.
Sydney. P. Sherman 42 Wallaby Way, Sydney. P. Sherman 42. Nemo! It's you! Nemo! Yes, Nemo!
It is worth noting that Dory's optimistic attitude mirrors the willing attitude of RR in the case study, and both individuals likely have higher success in implementing memory strategies as a result of their positive mental state. Furthermore, both Dory and RR had social support from family and friends that had a beneficial effect on their memory ability.
And if you leave, I remember things better with you. I do. Look, P. Sherman, 42, I remember it. I do. It's there. I know it is, because when I look at you, I can feel it. And I look at you and I'm home.
For the most part, Finding Nemo accurately depicts some of the daily challenges that individuals suffering from anterograde amnesia endure, in addition to the difficulties those who care for them have to face.
Just keep swimming, just keep swimming, swimming, swimming. What do? We swim, swim.
Dory, no singing.